Any health-related information on the following show provides general information only. Content presented on any show by any host or guest should not be substituted for a doctor's advice. Always consult your physician before beginning any new diet, exercise, or treatment program.
Welcome to Accelerated Health TV and Radio Show. I'm your host, Sarah Banta. I'm a health coach, natural supplement expert, and a busy mom of three. Make sure you hit the subscribe button below so you're notified every week with my new podcasts on Mondays and Tuesdays. And if you haven't already, join my free group coaching on Telegram with the link below. I teach you on a daily basis with tips and tools to enhance your health. And you will be a part of an amazing group to support you on your journey, in addition to truly taking control of your health. My goal is to reach everyone on earth with eyes to see and ears to hear my message of healing. Help me with that goal. Share this podcast with a few of your friends who may need my help, and especially with this one. We've got Dr. Amie Hornaman back. She needs no introduction. Welcome, Amie. How are you today?
Hi, Sarah. Thank you so much. I love being here.
Yes, she is the Thyroid Fixer. She truly is the expert of the thyroid. And she, like me, is on a mission to optimize people and help us all feel our best. And I love going back and forth with you because I feel like the two of us are just biohackers of ourselves, and we're open books on what we do. And we're women, just like all of you out there, struggling with hormones. And today we're going to talk about how you can balance your hormones naturally and if you need to take additional steps. So it's such a big topic. You talk about insulin. People don't think about insulin as a hormone. Thyroid hormones. When people talk about hormones, they think about progesterone, estrogen, testosterone. Oh, my libido's going down. I just feel blah. Menopause, perimenopause, or maybe they're thinking about PCOS and can't get pregnant during their fertility years. That's what they think about when they're thinking about hormones. So why don't you just start with just an overall basis of what are hormones and what are their role in the body?
Absolutely. So hormones are messengers. They're delivering a signal to our cells. So if we're talking about thyroid hormone, that's a big one that you talk about a lot on the show. Thyroid hormones are delivering that message of, hey, let's stimulate the metabolism. Let's increase ATP production. Let's help this person have energy through the day. Let's help them poop through the day. All hormones send a message. So when you're talking about the sex hormones specifically, and let me add on to that, if you go to your doctor and talk about hormones as a woman, you're going to only get estradiol tested. You're going to get your estrogen because for some reason, conventional medicine thinks that women only have estrogen in their system. I don't know. I guess they forgot about all the other hormones out there and their importance, but it's fascinating when you deep dive into what the different hormones do to the body. You really step back and realize how crucial they are for everything, for how we look, feel, and perform, but also for how we age and our brain protection, bone, breast, heart. It keeps going. Our voice, not getting the old lady voice as we age, all correlates back to hormones.
Right. You're exactly right. And it makes me think about when you go to the doctor and you are gaining weight and having hypothyroid symptoms and they only test TSH, right? So that tells the full story, right? No, there's so many things that are interplaying, and the thyroid has an impact on our sex hormones. So why don't we talk about the thyroid hormones and how they can actually affect your sex hormones?
Thyroid's the master. You always have to start there. So we start with thyroid hormones. We look at those first to determine, is there a low hormone situation here, specifically with T3? because that's the active thyroid hormone. So that's what's actually getting to your cell and turning it on and giving you the metabolism and giving you the ability to go to the bathroom every day and giving you that energy and brain function. Without T3, nothing is happening. And then when the thyroid gland is low, when the thyroid isn't producing enough T4 and T3, T4 is inactive, T3 is active. When you're not getting enough of that active thyroid hormone T3, that's where we'll start to see an effect on the other hormones. So that's where we'll see insulin resistance. Like you mentioned earlier, Sarah, insulin is a hormone. We have to remember that. So insulin resistance is where there's just too much insulin being produced by the pancreas, or the insulin can't actually get into the cell to do its job. We want insulin, we just don't want too much of it, and we want it working as it should. So when there's hypothyroidism, not enough T3, we'll see insulin resistance. Then we'll go over to the sex hormones, estradiol, progesterone, testosterone, and we'll start to see some wacky patterns there. Usually low, especially when we're talking about progesterone and testosterone, those will usually go low. Some women will develop estrogen dominance. So in the case of PCOS, we might see hypothyroidism, insulin resistance, low testosterone or high testosterone, and estrogen dominance as well. But when we start to work on the thyroid and start there, because it's the master gland, we see all the other hormones below it improve. Now, that's not to say that that's all you need. We'll still, as we'll talk about today, get into hormone replacement therapy, because some men and women, some people need HRT, the bioidentical kind, in order to get those hormones up out of the basement and to get the benefits of hormones, which we'll go into as well. But you have to start with the thyroid because it has such control over all of the other downstream hormones.
I just want to emphasize what you're saying as far as the relationship. I have one child who has a horrible menstrual cycle, and we've gotten the pain under control through some of the supplements that I've talked about in the past. And if anyone is going through that, just go back to my podcast on PMS. But what we've noticed is she will have a propensity for PCOS, like I have, and that you have a propensity to be insulin resistant. Well, what is interesting is that her body not changing her diet at all, and she eats clean. She eats in my house. I'm in control of her food. So she's eating the same foods. She exercises every day. But the week prior to her cycle, she becomes more insulin resistant. And then what happens is if she actually goes too low in her blood sugar from this period, she will actually create anxiety in her body. And there's no trigger, but there's just this feeling of anxiety. So yesterday, I actually talked about mental health and mood and the importance of thyroid for your hormones and your neurotransmitters like serotonin and GABA and dopamine and your brain, and anxiety and depression, and that link between thyroid and mental health. But there's also this link between your hormones, your blood sugar, your insulin, and then how that is going to affect your anxiety or depression. So they're all kind of interrelated, and the HPA axis, the hypothalamus pituitary adrenal axis, is very closely related to the hypothalamus pituitary thyroid axis. And then the gonadal axis. They're all interrelated, and the thyroid is the master endocrine gland, like you talked about. So it's like this big sphere, but you want to take care of that thyroid first, and then if there's still some tweaking that needs to go on, to go in deeper. The other thing I wanted to mention, that just a personal story from just this last week, and it always shocks me. I did a liver flush. And literally, I was retaining probably 5 pounds of water for the last 2 weeks. I could feel my thyroid slow. I was definitely under extra stress. So there's all of these things. You've got the stress hormones, cortisol, right? And then you've got that probably in my body was causing reverse T3 to increase and free T3 to go down. I could just feel it.
Yep.
And the liver is where it cleans all the xenoestrogens out. and takes all the bad estrogens out, right? And if it's backed up, it's not working well, then it's going to cause a backup in all of these things, and everything's going to just, the wheels fall off. And that's how I explain it, right? Do a liver flush, literally water gone. I can feel my thyroid take a jump up. I can feel the excess estrogens out. I can feel my good testosterone back. And I love testosterone, right? So this is just an example of how everything is so related. It had nothing to do with calories in, calories out. It had nothing to do with what I was doing in the gym. In fact, I actually worked out less. And I wasn't really looking at my food. So there's so much here, and we need hours to go into all of it. But I want to first, I want to make sure we get to PCOS, estrogen dominance, and menopause. So why don't we start with PCOS first?
Okay. PCOS, polycystic ovarian syndrome. They're actually talking about changing the name because the diagnostic criteria keeps changing, where it used to be that you had to have cysts on your ovaries, hence the name. Now they're saying, well, you actually don't have to have cysts on your ovaries. You could have the culmination of all of these other symptoms or markers, and we're going to call it PCOS until we change the name of PCOS. Basically, it's a high androgen, low progesterone, insulin resistant state with irregular cycles. And yes, sometimes there can be cysts on the ovaries, tiny, tiny little cysts. And sometimes there's not, but you just have all of the other kind of metabolic syndrome symptoms and labs that point to PCOS. Most of the time it's diagnosed when you're younger. And the other presentation of PCOS will be acne, dark facial hair, although again, not always. So my own story with PCOS, this is after I was diagnosed with hypothyroidism. I went back to my functional doc that saved my life and got me into this world of functional medicine. And I said, now all of a sudden I look like a prepubescent teenager here. Like, what's all this acne on my face? And by the way, why have I gained 5 pounds? Like, this isn't cool. Or maybe it was 10 pounds. And he looks at me and goes, you have PCOS. We can do a vaginal ultrasound if you want to check it out and confirm it. But you're insulin resistant and your testosterone surging. You have high androgens. Now, I did not have the facial hair. I didn't have the dark like sideburns or mustache or anything like that. But I had acne like crazy. And my cycles are maybe once every 5 months. And, in my 20s, I didn't care. But I realize now, like, that's not good for you. Like, you really don't want that. So he did not put me on birth control like the standard of care in conventional medicine will do. If you have PCOS, you will get birth control. That is standard of care. He actually addressed my insulin resistance. We did use metformin. Back then, berberine wasn't even a thing. I mean, we're talking 20 some years ago. Wasn't even a thing. So we used metformin, which I don't have a problem with. I prefer to go the berberine route, but I'm okay if someone's on metformin. I'm like, well, maybe we go back and forth between metformin and berberine, or maybe we try to transition you over to berberine. So I went on metformin, and then he also used natural, bioidentical progesterone. Instead of the progestin that's in birth control, we actually use progesterone. And at the time, being in my 20s, I only needed it for a short amount of time. And I eventually went off of it because lowering the insulin and bringing in the progesterone really seemed to help. And then I also went on Vitex Chaseberry, which naturally supported my progesterone levels. So that allowed me to go off the progesterone, the bioidentical, and just stay on the Vitex. And that kept my skin clear. I lost the weight. Cycles eventually started back to normal. It took about a year. So I usually tell my patients, like, listen, give it time for your cycles to regulate, but they will start to regulate once you take down that inflammation from that high insulin and really bring up your low progesterone levels. Now, accompanying low progesterone, there is an estrogen dominant state that occurs. So whether your estrogen or your estradiol is flagged high or not, doesn't matter. We have to look at estradiol in relationship to progesterone. So when progesterone is low, And I have seen it postmenopausal levels in PCOS patients. I've seen postmenopausal levels in women in their 30s and 40s. When that progesterone is low, I'm talking like the 0.5, the less than 0.5, even being a 1 or a 2, that's still very low for progesterone. And when that is low, and let's say estradiol, even if it's at 150 or 200, it's not flagged high on your lab. So it doesn't have that little H next to it. It's not red. So you're not looking at it going, whoa, what's wrong with my estrogen? But in the functional world, I'm looking at it going, wait, your progesterone is so low that it's putting you into an estrogen dominant state. And this is actually what birth control does too, by the way. Birth control will tank your own progesterone level and will make you estrogen dominant. So the very thing they're giving you in conventional medicine to help with PCOS makes the whole situation worse. And birth control tanks your thyroid too. So when we're looking at that estrogen to progesterone ratio, I hesitate to say this because I've said this on my podcast too, and then I get 5,000 emails because people are trying to do the math. It's roughly, if it's outside of a 1 to 10-ish, 1 to 20-ish ratio, then we say you're estrogen dominant because of that low progesterone. So the progesterone, let's take it at a 1 for easy math, and your estradiol is at a 150. You are outside of the 1 to 20 ratio. You take 20 times 1, it's not 150. You're now estrogen dominant. Now, sometimes I'll get these questions when a woman has a really nice, healthy progesterone level of, let's say, a 10. I like it in the double digits. Let's say she's a 10. And then we times that by 20, but she's like 250 in her estradiol. Am I going to call that estrogen dominant? No. So we have to look at you as a person too. We have to look at your symptoms. Are they correlated with E dominance or not? But that progesterone to estrogen ratio can also tie in. And we'll see that in PCOS as well.
So let's dive into the different estrogens because they're not all equal. And people hear about estrogen dominance. Well, don't I need to be taking estrogen? There's so much confusion around increasing estrogen, and not too much of a good thing, right? It's that balancing of the hormones. Yes, testosterone feels great, but you don't want too much of that. And
Right.
I too had PCOS. I had insulin resistance. And I also was listening to you talk about that it could also be connected to your adrenals, which I thought was very interesting, that PCOS can be linked to adrenal imbalances as well. But when you talk about the different estrogens, let's go into what they are, what their purposes are, and define the different ones so people really can grasp what they're asking for when they are going to the doctor and saying, do I need more estrogen? Do I need to balance my hormones? Or what is too much of a good thing or a bad thing?
Okay. So yes, you can get your total estrogens tested, but we really want to see the breakdown because there are 3 different estrogens. Estradiol is the most important. That's the one that's giving you the protection. That's the one that's giving you the vaginal lubrication, the voice box protection that I talked about in the beginning. It protects your hair. It protects your bones from osteoporosis. It has breast protection, heart protection, bone protection, brain protection. So when we replace estradiol in menopause or perimenopause, once it starts tanking, I don't care where you are, we don't have to label you as menopausal. Once your estradiol is in the toilet and we start replacing it, we actually see a very significant decrease in dementia and Alzheimer's. So it has a neuroprotective effect. I mean, hormones in general do so much. It would take us an entire episode to list out the benefits, but just to give you kind of the overall view, that is estradiol. When you start losing your estrogen, when you start losing estradiol, your bones become brittle. You start to get that old lady see-through hair that I always talk about, where literally it's so thin you can see the woman's scalp. Your voice box starts to change, vaginal dryness, vaginal atrophy, pain during intercourse, hot flashes, midsection weight gain, brittle bones, if I didn't mention that, cardiovascular disease, insulin dysregulation. So we'll see more insulin resistance, and the list goes on. Estradiol, we want that above a 50, minimal. Ultimately, we'd like it 80, 100, 120, something like that. But above a 50, 50 is my cutoff. And many, many women that I see when we go over their labs, their estradiols rolling in at, well, sometimes it's non-existent, but even at a 20 or a 30, and they're being told that they're normal by their doctor, and they're being told they're normal because they're in menopause. Well, this is normal because you're getting older. Well, wait a minute. We can replace that. So when we use bioidentical hormone replacement, we're mainly replacing estradiol. Now, there's another even over-the-counter cream called Biest, and that contains estradiol and estriol. Estriol is another estrogen that is mainly present when we're pregnant. It's a weaker estrogen. Now, some women, and this is rare, some women won't tolerate estradiol. They'll get bloated. I mean, just with a itty bitty dose, they'll start to bloat. They'll get really sore breasts, tender breasts, fibrocystic breasts, but that's where the iodine comes in and helps with that. So I throw them on the Accelerdyne, but if they still experience that, then we will move to a Biest cream, which is a little bit more estriol based. I don't really want to see estriol numbers on a lab unless you're pregnant. So I'm fine with that estriol being non-existent, less than 10, less than whatever the lab value range is. Not even detectable. That's fine. Estrone is your growth estrogen. Now, all estrogens have a growth factor to them, meaning that they can stimulate growth, which we want that when we're talking about collagen and elastin in our skin. Estrogen's good for that. We want it when we're talking about our hair. We don't want it when we're talking about cancer cells. And this is where all women start to get the deer in the headlights look like, but if you put me on estrogen, I'm going to get cancer, right? And this is all tied back to the Women's Health Initiative study, which is the largest, most expensive, worst study done in history. So I heard Peter Attia, I'm going to side note this really quickly. I heard Peter Attia talk about this, and he said, and I agree with him, short of what's happened in the last couple of years, the WHI is the most detrimental thing that could have happened to women's health in history, because it scared women and their doctors away from using bioidentical hormone replacement, from using estrogen and progesterone. And this particular study was so poorly done. Just to give you a little tiny snapshot of what I'm talking about, they took women 10 years after menopause, they used synthetic hormones, and they did not test for pre-existing conditions. So what they use are these garbage synthetic hormones like that in birth control. And then they said, we have a couple of women that got cancer. Hormones cause cancer. And that was the result. And then every doctor around the world pulled hormones away from women, took their estrogen away. And now we see why are we in this place of increased breast cancer, increased dementia and Alzheimer's like we've never seen before. Heart disease is the number one killer of women. I mean, come on. When we're talking about estrone, that's the one that we want to watch, because estrone can become estradiol. It kind of shifts over. So we don't panic if that's a little high, but we want to just keep an eye on it. I don't want your estrone being higher than your estradiol. We're not going to give you estrone. On a Dutch test, estrone would be correlated with the pathway of estrogen that we don't want you pushing down, because that, and I'm going to say this very gingerly, that could increase your risk of breast cancer. But if we bring on the estradiol, the protective estrogen, then it kind of squashes out the estrone. And then we can use different things to push you down the correct pathway. N-acetylcysteine. We can use, oh gosh, I'm blanking. I mean, NAC is the big one. There's some others that I would have to look up that we can use to push you down that other pathway. So those are the three estrogens in a nutshell.
What you were just talking about with the study reminds me of the salt and iodine. and history just making these things so people so fearful, and the studies being so wrong as far as how they are being run to create this fear over hormones, over estrogen, over salt, over iodine, over cholesterol. Well, you got to think, where's the money, right? And where you got to follow the money. So
Follow the trail. Yep.
I'm so glad you touched on that. So let's talk about, before we get into the supplements, what lifestyle hacks can people do to balance their hormones? Women, especially. We're in an era where our food is just adulterated with the GMOs and the xenoestrogens, the microplastics in the salt, as I was just talking about salt. You've got the amyloid proteins that I've talked about in some of the chicken and the poultry, and that's causing a disruption in the gut. And of course, the gut is related to your hormones. You have all of these things coming at us. So what do we need to do in our diet and our lifestyle to help balance our hormones before we get into supplements and then hormone replacement therapy?
So here's the thing. If you're being exposed to xenoestrogens left and right, then it's going to throw off your hormonal balance. And we may or may not see that on a lab. So sometimes we will see that estrogen dominant state when someone is continually exposed to these xenoestrogens. And sometimes we won't. We'll just see the symptoms associated with estrogen dominance. By xenoestrogens, what do I mean? The plastics, the BPA, even the BPA free plastic containers and water bottles all leach a chemical. Even if it's if it's not bisphenol A, they can just replace it with bisphenol F and call it BPA free, and you buy it because it has a little BPA free symbol on it. All the plastics, the fragrances, what you put on your body, what you put on your face, what you wash your hair with, what you spray your body with, what you put, those stupid Glade plugins that you plug into your wall, the different fragrances that you put around your house, Febrezing everything, pesticides on your food. I mean, hormones in your meat. We're being bombarded, and that's just kind of scratching the surface of daily living, right? I mean, we are being bombarded left and right. There's so many that I haven't even talked about. The weed killers, on and on and on. That it's literally throwing off our hormonal balance. Why do we now have fish that are two sexes? I mean, we have male fish turning into female fish and laying eggs. I mean, it's the craziest thing that we've never seen in history until now. We have men walking around. I mean, go to Walmart or go to an amusement park or go to the mall and just for fun, look at the men walking by and look at their chest. You seen a lot of man boobs lately? That is estrogen, folks. Men are not supposed to have boobs. They're supposed to have pectoral muscles, not actual breast tissue. And that is estrogen in our environment and what they're being exposed to and what they're putting in their bodies. So just simply cleaning up your life, clean out your bathroom, clean out your cleaning closet that you use to clean your house with. Get rid of the fragrances, get rid of the perfumes and the Bath and Body Works sprays and all of the garbage that you have control over on a daily basis. The parabens, the phthalates, the this late, the that late, the glyphosate. Get rid of it, because that behavior modification alone will improve your internal hormone balance. Now, you're not going to Benjamin Button yourself, right? You're not going to reverse aging. I mean, you can reverse it to a point. We can lower our biological age or chronological age, but you're not going to stop the hormonal decline. That will continue to happen. But we can replace that, and we'll get to that. We can replace those hormones. But in the meantime, as you age, you can significantly improve how you look, feel, and perform by getting rid of that garbage that's throwing off your hormones.
It's so funny, and I don't want to get political here, but I've got 3 kids, and what they're seeing in the high schools and the non-binary and the gender fluidity and all of that. You guys, it's all connected.
I
It's
was gonna
no
say that. I'm glad
I
you did. I was
it
I was gonna bring that up.
it's not, I mean, it's so confusing for these kids because they're being told this stuff in social media, but at some level, it's the hormones inside of them that is saying, "Oh, well, this is actually an option." Where just even 10 years ago, it wasn't even an option in their heads. So
Mhm.
think about it. Think about what is happening to our young men who are supposed to have sex drives through the roof from 18 to 30, and they're having erectile dysfunction at higher rates than ever. I
Yep.
mean, that's not normal. So,
Yep.
hit yourself in the face and wake up. We have to do these things that Amie's talking about when we're looking at our diet, what's in our pantry, getting rid of the processed foods, eating clean grass-fed meat, not eating these vegan versions of burgers and whatever they're going to come out with. I mean, who knows what's in those?
Yeah.
Um, and then, making sure we're detoxing on a regular basis. And detox is not optional anymore. It's
Right.
mandatory. And doing the liver flushes, like I've talked about, because the liver is cleansing the blood. It is producing that estrogen binding protein to help with these xenoestrogens and balancing the hormones. It's also where your T4 converts into T3. So that improves your thyroid. That's why I literally feel my thyroid jump up when I do a liver flush.
Mhm.
But all of these things are so important. And then sleep, of course,
Right.
right? And
Right.
then and
Big.
moving our bodies. You got to sleep, because just not sleeping well is going to just derail your hormones. And Amie, I want to make sure we get into the supplements and the HRT. So I'm gonna skim over the sleep part, but guys, you got to sleep
Right.
for so many reasons. So let's get into the supplements. I know that I take your hormone fixer every single day. And I had PCOS. As soon as I took care of my insulin resistance, my hormones regulated on their own.
Mhm.
I have supported my hormonal balance with a supplement called Menopause Health, which I recommend for anyone over the age of 30, just to help prepare the female body for menopause coming, and to make sure there's vitality, and it just is a supportive supplement, Ayurvedic herbal supplement. When I started the hormone fixer, I just felt more vitality. I felt more energy. I felt more lean muscle being able to be built.
Mhm.
It didn't cause me to lose hair or have my acne
Right.
or anything that was related to too much testosterone in the female body. Can you describe how the hormone fixer helps balance hormones?
I love Hormone Fixer. I take it every day too. I swear I get better workouts when I take it versus when I don't. So the Tonkat Ali in there actually improves growth hormone levels. So Tonkat Ali is fantastic. It will naturally support your testosterone levels. So as a woman, that's fantastic because it's not going to push you through the roof. Like Sarah said, it's not going to cause hair loss, acne, all of that, but it's just going to love on and kind of nurture and naturally raise your test levels. So we've seen in my patient population, testosterone levels go up anywhere between like 10 to 20, maybe even 30 points. So when we're looking at your total testosterone, I want that above a 50 as well. And women who are at 20 or 30, they really get bumped up above that 50 mark and into the optimal range with Hormone Fixer. And then Tonkat Ali will raise growth hormone levels. So we know growth hormone declines as we age. Tonkat Ali helps support growth hormone levels, and it acts as a little bit of an aphrodisiac. So for those of you noticing some low libido, that helps as well. And then we have the saw palmetto in there, which is a DHT blocker. Now I am actually in the works of coming out with it might be called DHT Fixer. I haven't landed on the name, but a blend of a higher dose of saw palmetto with nettles. And that really helps to block DHT for women that are on testosterone replacement therapy. And they might be experiencing some of that elevated dihydrotestosterone that can cause hair thinning, hair loss, and acne. So that will be coming out soon. But in Hormone Fixer, we have a small amount of saw palmetto, which for most women, that's just enough to block that DHT conversion. And then there's Tribulus terrestis, which that helps as well to bump up that testosterone. So it's the Tribulus and the Tonkat Ali together that really help to support and nurture those testosterone levels. Now, testosterone for women, we know, is the good stuff done hormone. That's what's giving you the motivation and the libido and the ability to build muscle mass, get put on lean muscle, lean body mass. So decrease your fat mass, increase your lean muscle mass. And then just feel good all the way around, from brain function, lifting of brain fog, to just that drive to do things and the drive to go to the gym and work out. So that's where testosterone comes into play, and that's where Hormone Fixer comes into play.
And how does that balance out with your estrogen levels? If someone's suffering from, low estrogen, then how is the Hormone Fixer playing with that?
It's not going to directly address low estrogen, but it will in an indirect sort of way. So we know that testosterone can aromatize into estrogen. So women who are a little bit low in their estradiol, they may benefit from taking Hormone Fixer because of that aromatization. Although if you're very low in estradiol and you're below that 50 mark, that's where I would want to bring in the replacement, the bioidentical.
Okay. Before we get to HRT, I want to just touch on iodine really quick.
Yeah.
Iodine regulates estrogen production, helps cleanse the blood so the liver can detox the estrogen, the bad estrogens effectively. So in effect, it's helping regulate estrogen. It's also estrogen and progesterone attached to the same receptor site, and progesterone, like iodine, induces healthy apoptosis.
Yep.
So most women would benefit from increasing progesterone, and iodine helps increase the availability of the receptor sites for the progesterone by regulating estrogen and getting rid of the bad estrogens. Are you seeing this in your clients? I mean, I know you've been using the acceleradine with a lot of your clients. What have you noticed?
Well, I make everybody go on iodine because I always say if you told me I can only choose one supplement for the rest of my life and that's it, it would be iodine because of all the benefits. It would be acceleradine.
Yeah.
I put every single one of my patients on acceleradine because of all of the benefits. You have the hormone regulation, you have the detoxification, you have the T4 to T3 conversion, you have the detoxification from the halides that downregulate thyroid function. You have the hair loss help because iodine does help with hair loss, fibrocystic breasts, the immune system. I mean, I'm upping mine because I'm getting on a plane tomorrow. I got the iodine in a little spray bottle for my nose, and I'm taking extra acceleradine. I have been for the last 5 days just to boost my immune system because of everything I'm going to be exposed to on the plane and at a conference. So, to me, it's not that I've necessarily seen a specific reaction or change in individuals because everybody's on it, but I know that it's there helping in the background for everything else that we're doing.
Absolutely. It's like, okay, let's make sure our sleep's right, our diet's right. We're cleaning out our house of all the plastics and the xenoestrogens. We're doing all of these things. We're taking our acceleradine, and now someone is still like, I'm just not feeling it. Right? Okay. We only have 10 minutes, which I can't believe. We're going to have to do a part 2 on this to really dive into your experience. But can you tell people what you've been experiencing with HRT and what you've noticed?
Absolutely. So it's life. It's coming back to life. It's keeping your youth. And, there might be listeners out there that go, oh, I don't care about staying young. I'm just going to age gracefully. Well, here's the thing. With age and with hormonal decline comes death. So we know that animals, when they stop procreating, when they lose that ability to procreate, they die. They basically shrivel up and die because that's when disease comes on. And I actually did a podcast and I entitled it Menopause as a Disease State. And oh my gosh, the Instagram, it's not a disease state. I go, that's just the title of the podcast, but it's to make you think. It kind of is, though. As our hormones decline, you have, significant increased risk of Alzheimer's, dementia, Parkinson's, heart disease, breast cancer, colon cancer. The list just got all the diseases of aging start to come on, type 2 diabetes, just inflammation in general. The lack of hormones is an inflammatory state, and hormones give us life. They protect us. So for those of you scared of hormones causing cancer, even after we just went over the WHI study, just think about the kids running around, 14, 15, 16-year-olds, highest hormone levels of anyone. Is there cancer? When's the last time you knew a 15-year-old with breast cancer? I don't. Never heard of one. So hormones are protective against cancer, and they protect our breasts and they protect our brains. Now, the bonuses, right, is the vaginal lubrication, the plumpness of the skin, the protection of your voice box, the help with your hair. All of that comes, the muscle tone, the body fat percent, the lean muscle mass. All of that comes from hormones. And when it's funny, Sarah, when I get a patient that's like, am I going to have to be on these the rest of my life? I'm like, well, I don't see you aging in reverse, right? Like the Benjamin Button scenario I gave earlier. It's not like you're going to all of a sudden eat your way to more hormones. Once you start into that hormonal decline, and like you said, when you're doing all of the things, but listen, once you start aging, hormones are going down. And that might hit you at a variety of different ages. I've had women in their late 30s, 40s that need hormone replacement. I have a woman right now who is 57 and her hormones are still beautiful. The only thing we have to use with her is testosterone, but her estrogen and progesterone are perfect, not even in menopause yet. So it just kind of depends where you are in life. But eventually, even that 57-year-old will be on testosterone, estradiol, and progesterone, all three. Once they're needed, we bring them in, because if we can replace those hormones that are no longer being properly made, we give our bodies back life, extended life, vitality, and protection.
Yep. So what are you doing, and what are you seeing with the different hormones that you're taking and the changes? I know you've been adjusting up and down. What have you seen? Because it is a balance. It's not like more is better, right? I'm a type A personality. A little is good, more is better. Doesn't work that way. And I'm sure that the hormone replacement therapy you're doing will have an impact on your thyroid and maybe your insulin and your sleep and some of these other things that you have to constantly probably tweak, and it's very bio-individual, I'm assuming. Is that what you've experienced?
Very bio-individual. You really have to find like what's going to work for each person. So when I started hormones, and I can honestly say, just with all those things that you just mentioned, I kind of did a checklist in my head, and I have never felt better in my entire life than I have the last year, I would say. And I attribute that to hormones, because my cycle stopped about a year and a half ago. So that's like, okay, here we go. We're entering that dreaded menopause. But I knew I was going to bring the hormones on board. I was already on testosterone, already kind of playing around with progesterone, doing a 2-week on, 2-week off cycle of oral progesterone at night. And then I knew it was time, when I tested, it's time to bring on the estradiol, because my FSH was going up, estradiol was going down. So I knew it was time to bring that on. Now, I started with static dosing and immediately noticed that, again, that the vaginal dryness, the vaginal atrophy, the pain during intercourse, my hair got better, my skin got better. But then I started noticing my sleep getting better. I've always had issues with sleep. Since I was in my 20s, I've had issues with sleep. And that has definitely improved, I mean, tenfold, to where now I fall asleep on my own. I mean, I still take my progesterone, my magnesium. I'll take GABA. I'll throw in a Delta 8 if I have to, but I'll still take all of that. But my sleep is good and it's deep and it's restorative. I mean, I have fantastic energy through the day. I mean, as you know, when you're working with clients, when I hear my patients and they're like, I'm just dragging through the day. I mean, I might have 1 or 2 days like that because I'm still a woman and I'm still a human being, and we're not going to have every day be amazing. So I'll still have those low days. And when I do, I'm like, man, this just sucks if this was ongoing. And it is for so many people. And that's usually the result of low thyroid function or low hormone function. So what I've really noticed is just an improvement in life and vitality with using hormones. Now, I've shifted over because, like you said, we are biohackers and we do things on ourselves so that we can pass it on to you. I am now and have been since March doing rhythmic dosing, the Wiley protocol. So I'm rhythmically dosing my hormones to induce a cycle. I am one of the very few women out there that I don't care if I have a period every month. Like, it's never bothered me. I never had bad ones, whatever. To me, it is kind of connected to being youthful. So we're still working on inducing that cycle. But I got to tell you, even with the hormones that I've been on, I'm like, I feel great. And I can honestly say that, and I don't know what exactly to attribute this to. I mean, I would say it's the testosterone, it's the hormone fixer, and it's the even bringing in the progesterone and estradiol, that I have better shape. When I'm working out, I'm like, I got a vein going down my arm now, which I kind of like. I have more shape to my muscles, more so now than when I was competing in my 20s. When I was like living my life at the gym, I have better shape now than I did back then. And I attribute that to better hormone balance all around. Yeah.
It is all about hormones, whether it's weight loss you're after, more energy, whatever. I mean, I remember, just as you're talking, the couple of years when I had toddlers and I was at my, rock bottom of health. I couldn't wait to lay down on the couch when I put the kids down for their naps.
Right.
And then I also couldn't wait to have a drink. And it was like becoming from 5 o'clock to then 4:30, then 4 o'clock, because I just needed something to keep me going and to take off the stress. I don't drink anymore. Not that I'm against alcohol. That's a whole nother story. Alcohol does increase the bad estrogens in the body. So there you go. As we're talking about hormones, don't kill the messenger here. But I have better energy now at the age of 48 than I ever have had. And if you told me I had to eat cardboard and take 1,000 pills to feel this way, then I'll do it, because that's what it's about. It's about living your best life. So we literally just even touched the surface here, Amie.
I know.
I could go on and on with you forever. So before we leave, is there any real takeaways that people should leave this? They're not feeling great. They don't know where to start.
Get the full hormone panel, know your numbers, and we want those in the optimal lab value ranges. Make the lifestyle changes that Sarah and I talked about today, because they will go a long way no matter what your age. They will impact your body, how you feel, your health, your hormone balance. And then you might have to go one step further and do bioidentical hormone replacement. I mean, we have so many patients on it. They're living their best life. They're feeling better. They're being protected against the diseases of aging. I'm a huge fan of it. We know it's safe now. We know it gives life and protects life. So sometimes you have to take that next step and do the BHRT.
Thank you. And where can people find you?
You can find me on all podcast platforms, the Thyroid Fixer podcast. So Sarah's been a guest many times. We deep dive into thyroid hormones, weight loss, all the things. So you can hear a lot more about hormones there. And then you can go to my website at dramihornaman.com. That's where, if you're interested in working together and possibly getting on some hormone replacement therapy or fixing your thyroid, you can book an application call there, and we will go over your health and all the different services that might fit you.
Amazing. I always love being with you. It's so
Yeah, me
fun.
too.
It's such a
Me too.
treat. And I know my audience loves you. That's why you keep coming back. So thanks,
Thank you.
Amie. And thanks everyone else for joining us. If I can help you with your health issues, you can contact me directly through the website, sarabantahealth.com. Happy to put together a protocol for you. I have some articles on the website about estrogen dominance, about hormones. There's a lot of more information there. And if you have any questions from today, put them in the group coaching on Telegram with the link below. I will go over it. And if I don't have the answer, I know where to find Amie and I can get her to answer the question. So join us there. I teach you on a daily basis with tips and tools to enhance your health. And you will take control of your hormones and your health. You can follow me on Facebook and Instagram under Accelerated Health Products, across over 100 channels under Accelerated Health TV and radio show. And like I mentioned, my goal is to reach everyone on earth with eyes to see and ears to hear my message of healing. Please help me with that goal. Share this podcast with a few of your friends who may need my help. A lot of censorship has been going on lately on some different channels. So I need your help more than ever to spread the word organically. So please do so. Join us every week, Mondays at 2 p.m. Pacific, Tuesdays at 1 p.m. Pacific, and you can find the supplements, all my articles and podcasts on sarabantahealth.com. Use coupon WELCOME10 for 10% off site-wide. Thanks for joining us here and have a great week.